Well, good evening, everybody. This is Voss Speros, Greek out of Medicare, doing a Monday night Medicare live. Thought I'd jump in here on Monday nights and do a little bit of Medicare overview on some things, talk about what's coming up, and then a little Q&A. I got the comment thing over there. If you happen to be on, that's great. The Q&A. So, a once over, Medicare is an 80/20. You go on it at 65. The Part A covers hospitals and the Part B covers doctors. The 80%, the 20% is basically the doctor's co-share is what your 20% is. And to cover that, there's advantage plans and then there's supplement plans. So the supplement plans you pay monthly to have, and and then they cover the co-payments for the insurance. So there's an a la carte is the supplement side. You get the Part B, the supplement plan G about 150, a Part D plan, a dental vision hearing plan, and gym membership. You already have that. So you pay monthly for those. The Part D prescription drug plan you pay monthly for, and you still have co-payments. But the Plan G, you pay monthly for that, and then there's the Part B deductible of $257, and then there's nothing past that. So that's really good. The Advantage plans, you generally there's no cost, no premium for those, and you pay a co-payment at service. So there's the a la carte. So you have the all-inclusive and the a la carte. And the a la carte, the all-inclusive and a la carte, yeah. So the all-inclusive, the Advantage plans, there's generally no cost for that. There might be a deductible, but usually not. And then there's a max out of pocket. So the most you pay in co-payments over the course of the year, when you reach that mark, you don't pay anything over that. So really, the Advantage plans is a co-payment at the time of service. There's HMOs and PPOs. And on the HMOs, you stay in the HMO network and you see the providers there. Most HMO networks aren't really requiring a referral, but a doctor might require a referral. So it's always good to get a referral from your PCP before you go see a specialist. The PPO plans are in and out of network. It's like a supplement. You get access to the network and then outside of the network. So anybody who takes Medicare and is willing to bill it, you can go see. This year, a lot of PPO plans are going to disappear. So I can't say anything until the 1st, but just be ready. If you're on a Medicare Advantage PPO plan, it's probably going to go away. There's only a couple of companies, only a couple of plans that are going to actually make the cut and stay. So make sure to just see what your plan is. Give us a call and let us review and make sure it's going to stay or not. United Healthcare already announced that their plans are going away. So, I mean, that's public knowledge. The PPO plans for United Healthcare are gone. If you're on one of those, give us a call. We'll get you, figured out. So, when we review plans, we look at where you live, the county you're in, the doctors that you see, the hospitals that you use, the clinics that you use, your prescription drugs, and then once we have that, we determine what plans are available that match the majority of what you are looking for. And then we go into dental vision hearing. Maybe you wear glasses and you need some glasses. Maybe you need some dental work, and we kind of put that in. Maybe you need some extra PT, so we put that in. The camera is like backwards. I don't know. So we put in all these different filters when reviewing plans to see what's going to work best. In Maricopa County, there's over 100 different Medicare Advantage plans. So that's real. So we can really dig down deep and find something that works specifically for you on the Advantage side. Knowing that, so another thing that I gotta say, since plans are dropping, completely ending, they're deleting plans. So the UHC PPO plans are just being dropped completely, and those clients have to find a new plan. Since a plan is ending and dropping, it gives you a window to go on to a Medicare supplement plan, Plan G or N, Plan G, with no underwriting. So a guaranteed issue to go on a Medicare supplement plan, which is great because most people don't have that. Everyone has to go through underwriting. They prefer you go through underwriting, but it gives a guaranteed issue. So there's a handful of carriers dropping their supplement side too. So there are carriers dropping the supplement side, and there's a handful of carriers that have the guaranteed issue Plan G. There's supplement carriers that have Plan Gs that you have to go through underwriting. There's only a couple of carriers that are going to do the guaranteed issue. So you have a guaranteed issue to go on a supplement, yes, but the company still has to accept that. There are companies that accept it, and there are companies that, you have to go through underwriting. It is what it is. Those are private insurance companies that are assuming the risk. So the supplement, you pay your monthly premium for that, and that company's going to assume the risk of your health care. If you're healthy and they know that you're just going to be paying into it, and they don't have to pay any healthcare expenses. So if they have to pay out healthcare expenses, then they're going to start increasing your rates. And they just increase rates every year, about 5 to 10%. This year, there's going to be a big rate increase across the board for everybody, again. But on the supplement side, the rates are increased. I totally lost my train of thought on that one, and I don't have my assistant saying, "Hey, this is what you were talking about." So the guaranteed issue is there. You go through that and you get it, and assuming the risk. That's what it was. So on the Medicare Advantage plans, the Advantage plans contract with Medicare and offer Medicare, so they get paid by Medicare to cover your healthcare costs. The supplement side is they're assuming the risk. So if you're sick, if you're coming out of a skilled nursing and someone says, drop this Advantage plan and go on straight Medicare because the supplement pays better. It does, totally, but there's disqualifiers at that point. At that point, you have to go through underwriting. And if you're not healthy, they don't have to take you. It is what it is. If you go through underwriting and you're not healthy, they don't have to take you. Don't drop your Advantage plan until, you have a no of what you're going to do, but, keep that in mind. I know this was a off-the-cuff thing. We're going to do this every Monday night. A little discussion about Medicare and some Q&A, but I just wanted to just do it instead of procrastinating and saying, oh, I'll wait till my little studio gets set up. Oh, I'll wait till, you know what? You can see the back. It's okay. It's my office. I did get new shelving, so it does look a lot better. There is a hand right there. Look out for that guy. He moves sometimes. And we are getting ready for Halloween here at the office, so we have a party coming up if you want to stop by. It's always fun. Anyways, kind of looks like I'm alone here, which is okay. I'm just going to do my alone thing. Oh, there are a couple of questions. They didn't show up right away, but I wonder where they are. I gotta figure this live thing out. So, question: why are the plans going away? So that's a good question. It sounds muffled. Oh, is that better? I gotta work on the microphone. Maybe the microphone's not hitting. Well, something to look into for next Monday. So why are plans going away? It's a cost thing, really. the insurance carriers can oversee the cost of the HMOs because it's all in network. They know how much money they're getting from Medicare to cover, and they can track the HMO because it all stays in network and everything has to be referred. On the PPO side, there's in and out of network, so they can track the in-network stuff, but the out-of-network stuff they can't. So they have to keep money in reserve for when people go out of network to cover those costs. They were doing really good about it, but in the last few years, there's been a lot of shakeup in the Medicare field, and everyone's been tightening the belt a little bit for something coming up down the road. Not really sure what yet, but every year, the last couple of years, they've been kind of pulling benefits back and tightening up and tightening up. So that's basically the reason why they're getting away from the PPO plans. Are you? So the question is, are you a resource just in Arizona? If so, do you have a counterpart in New York? We are contracted in most of the country. We do have counterparts in other states. I'm based in Arizona. I'm in Mesa, so that's where I'm at. But I'm contracted pretty much all over the country, and I can answer questions for that. And I believe, I don't know if I'm in New York, but I have a counterpart in New York. Yes. Just drop me your information, and I'll get somebody to you. Well, that sounds good there. Thank you, Cindy. I hear you clear the whole time. All right, well, that's good. I'm glad people hear me clearly. All right. Oh, there's still no comments. I wonder why. Keyframe too long. Frame. Uh-oh. What did I do? All right. All right, so let's, I don't know, it keeps doing something. I don't know, something with the computer. Not 100% technical on everything, but I'm getting better at it. Getting better at it. Oh, 7 comments. I don't see any other ones. All right, so I think that's it. If there's any other questions, I don't want to take everybody's time up, but oh, you know what? Let me just do it this way. There we go. Okay, sound is muffled. Water plan's going away. Oh, thank you for your email. I'll jump on that one for you and get someone that can help you out in that area. All right. Oh yeah. So I pulled the mic a little closer to me. You probably see it's right there. But yeah. All right. So look forward to next week, and in a couple days we're going to be starting on the 1st. We're allowed to talk about the new plans for Medicare for 2026 for the Advantage plans. If you are just keeping note, we're going to be talking about that. There's a lot of changes this year, and just keep that in mind that this year, just like last year, you had to do a plan review. This year, you have to do a plan review to see what's going on with the changes. A lot of plans are dropping, some names are changing, and some plans are being crosswalked over to another plan, which means you're keeping the plan. It's just going to a different name. Whole plans are losing in different counties. I think Moab County's losing a whole carrier that's purple. Figure that one out. On the PPO side, and then just plans entirely. So a bunch of changes are happening. A lot of plans are dropping, and just we'll talk about more of it next week, and I'll try to do some more videos just to keep it going. And I hope you have a good evening. And I'm gonna head out if nobody has any other questions. Yeah, or I'll just sit here for a minute, see what happens. Actually, low quality streaming, so I gotta figure out my camera, which I have. I'm just waiting for my little studio to get set back up from our previous podcast. So I did a podcast with another guy. Things didn't work out so well, not on my end, but well, yeah. So anyways, we're going to be setting up shop here in the office, off to the side here, and doing a podcast interviewing people for senior health care, and then going over Medicare and different insurance tips and trades. I think that's about it. About 17 minutes in. Thank you, everyone, for jumping in and asking the questions and chatting with me for a little bit. But about time to head out and go get some dinner. Have a good one.